Midwives play an important part in the birth of a child, but their role goes so much further than this special moment. Our team wanted to learn more about how a midwife impacts ante and postnatal care, and so, to find out more, we asked an expert.
Hello, my name is Annette Briley and I'm the Professor of Women's Health and Midwifery Research based at Flinders University and the North Adelaide Local Health Network, a joint appointment funded through Flinders Uni and the Hospital Research Foundation. This is an amazing opportunity for me because as a midwife I can make a difference to one woman and her baby, one at a time, one family at a time. And as a research midwife I have the potential to change the health of generations.
So if I fall pregnant, who's the first person I need to see?
So if you've had a positive pregnancy test at home, which most people do these days, and you're planning to have your baby in Adelaide in one of the metropolitan public hospitals, the best thing you can do is contact the SA pregnancy referral line and they will sort out a booking for you at your nearest hospital. If you are intending to deliver in a private venue or you're concerned in any way, then the first port of call probably is your GP.
At what stage is a midwife needed?
Well, I would say you always need a midwife. The sooner the better. Midwives are experts in pregnancy, in normal pregnancy, labour, birth and the postnatal period. So the sooner you get to see your midwife, the better, and they will follow you through the journey. There are different models of care. So for some women that will be the same midwife or same group of midwives all the way through. And for others it will be a midwife that may be attached to the hospital or the GP surgery or just works in the community or just works in the hospital.
If you came down to it, can a midwife deliver a baby?
Midwives do deliver babies. They are the total experts of normality. So if you've got a normal pregnancy and a normally grown baby and you yourself are well, there's no need to have a doctor involved at all. In fact, in their training, doctors do significantly fewer normal births than midwives. So that's absolutely what midwives do. So yes, of course they will deliver a baby.
What kind of support do women receive after giving birth?
So once your baby's born, you usually stay on the delivery suite on the birth centre for at least an hour, and the midwife will do the initial check on the baby and on you. They will then encourage you to do skin to skin where the baby lays on your chest or your partner's chest. We know that this is really good for the babies. It brings their heart rates down, it makes them calm, and it's a good thing to do, well into the first few weeks of life. Then you'll go to a postnatal ward, or you may go home from there, again depending on how long you're going to stay, and there will always be midwives around to help you feed your baby and to make sure that you're recovering well from the birth.
Can women see a midwife if they're not pregnant?
So most midwives are involved with pregnancy, but a lot of midwives do see women who are considering pregnancy. So if you're planning a pregnancy, and we know that a lot of pregnancies aren't planned, but there are things that you can do to get yourself fit and ready for that pregnancy. Things like lifestyle choices, cutting down on your alcohol, smoking advice, recreational drug use, losing a few pounds if you're a little bit on the heavier side. We know that that's a good start before pregnancy, and probably most importantly taking folic acid, making sure that you're in sort of the best condition you can possibly be before you get pregnant. In some situations that will be arranged through your general practitioner, through a preconceptual clinic, and in others it'll just be popping in and having a quick appointment with the midwife. Fundamentally, midwives are involved in the antenatal period, so as soon as you're pregnant, all the way through until your baby's at least 4 weeks old.